A patient did not receive an IV antibiotic for 3 days. The staff nurses were unaware that the students assigned to this patient were not allowed to give IV medications. Hello, welcome to Nursing with Professor B. My name is Bridget. I have a master's degree in nursing education. I'm also a family nurse practitioner. In today's video, I'll be going over examples of student nurse medication errors that occurred. The purpose of this video is not to shame the people that made these errors. The purpose of these videos is for you to learn from them so that you do not make these mistakes yourself. Following are some real life examples that occurred to nursing students. The first thing, if you are in nursing school, you know about the rights of medication administration. If there's an order for medication administration, one of the rights is that the medication must be administered in a timely manner. And usually, unless it's a time critical medication, if you have 1 hour before the medication is due and 1 hour after the medication. So let's say, for example, a medication is ordered at 11. The earliest you can give it is at 10 a.m. The latest you can give it is at 12 in the afternoon, like 12:01, it's late. That's already considered a late med. For time critical medication, you have a half-hour window. So if a medication is due at 11, you have to give it at 10:30 at the earliest, 11:30 at the latest. That being said, medications, you always, as a nurse, you always want to be checking your MAR and refreshing your screen, because sometimes, every once in a while, there will be a new medication that's ordered, and if you don't refresh your screen, it will bite you in the butt. So medications scheduled for administration during non-standard or less commonly used times, including early in the morning, are prone to student dose omissions. And not just students, also nurses. Like, for example, levothyroxine oftentimes will be scheduled at 6 in the morning. And I can't tell you how many times I would walk on the shift and it wouldn't be administered because the night shift would forget. Always check early in the morning and ask night shift if they can do it for you. Realistically, it is on their time to be giving the levothyroxine. So the example of the medication error that occurred here is that a student omitted an antibiotic ordered at a one-time dose at 1100. So let's say that this antibiotic needed to be given prior to the patient going to surgery. And because the patient doesn't get this antibiotic, now they can't go to surgery. So you always want to be very careful and not omit things, and you must communicate very effectively, especially if you are a nurse with a student or if you are the student yourself. And then another error that occurred is that a patient did not receive his morning dose of insulin because the student assigned to the patient had not arrived on the unit in time to administer the drug. So for example, when I take nursing students to the unit, I always tell them, tell the nurse you're going to give the 10 o'clock meds, because 10 o'clock is a big med pass. Instead of saying to the nurse, oh, I'll be doing all your morning medications for you today. Don't say that to the nurse, because morning medications is a big time window. So you want to be very specific. I will do the 10 o'clock, the 11, and the 12, right? After 12, we go to lunch. Always communicate with your nurse effectively. So recommendations to avoid this from occurring is staff nurses should develop a proactive plan with students that clarifies the details and responsibility for administration of each ordered medication and how new medication orders received during their shift will be handled. Staff nurses and nursing instructors should monitor patients' MARs and review potential omissions with students. I don't play when I have students on the unit. I am very hands-on because these are the kinds of situations I don't want occurring as a nursing instructor overseeing students on a unit. It's a lot of responsibility. The next one is documentation issues. The appropriate documentation is another medication right. With both staff nurses and students administering medications to the same patients, dose omissions or extra doses have been administered because students or staff nurses have not properly documented drug administration or reviewed prior documentation of drug administration. So God forbid you put someone in a hypoglycemic coma because let's say that the nurse gives someone insulin, they didn't scan it on the MAR, then you go give them some more insulin, and next thing you know, this patient's in a hypoglycemic coma. So the real life examples that happened is a student documented that he gave the patient his morning medications at 8:30, and these medications were still in the patient's drawer at 1700. This dose was omitted, and yet it was charted. So what happened there? Another thing is, never leave medication at the patient's bedside. Many times patients will be like, oh, just leave it with me, I'll take it later. No, you have to visibly see that your patient takes those medications. In another example, a student administered heparin to a patient and left the unit for a conference before documenting it. A staff nurse gave the patient another dose. So this is dangerous. If you give them too much heparin, they're at increased risk of bleeding out. Another one is a student gave a dose of LimoStudio to a post-op patient who had already received the medication in the PACU, which was documented on the PACU record. Okay, another example of now that LimoStudio is a blood pressure medication. What if you potentially bottom them out? What I mean by bottom them out is drop their blood pressure so low that then aggressive interventions need to be implemented in order to raise their blood pressure. So ways that you can avoid these errors is students and staff nurses should be using the same MAR. Students and staff nurses should bring the patient's MAR to the bedside and document drug administration immediately after the patient has taken medications. Now with electronic MARs, errors are less likely to occur, but they can still occur with improper communication or poor communication and without documenting at the bedside. As you're giving a medication, you should be checking it off. Right after that patient takes it, you should be checking it off. As you're giving medication, you should always be scanning your medication. Most hospitals now have a scanning system. Utilize it. It is a way of triple checking that you're giving the right medication at the right time, at the right dose, to the right patient, etc., etc. Encourage patients to review all sources of documented drug administration, particularly when patients are transferred from a different level of care or unit. So for example, if the patient came from the ED and the ED has a different MAR, you want to make sure that you're on the same page. Ask the ED what was given in the ED, what was not given, what do I need to give? When possible, include students in verbal reports about their patients. MARs unavailable or not referenced. Students may not consistently use the patient's MAR to guide the preparation of medications, and that I understand that you want to write things down on your own, but you really should be using the MAR that is provided, and may not bring the patient's MAR consistently to the bedside. I do not allow that. You have to bring your computer, and we're going with the computer to the patient's bedside. A staff nurse had given a patient a dose of methadone at 7:30. Although this was documented, the student also gave the patient a dose at 8:30. The student was using a worksheet she had created, not the MAR. A student gave the wrong patient a dose of digoxin and warfarin. The student did not bring the MAR into the room to assist with patient verification. Always, always ask your patient, ask them their name. You always have to check their ID band, their date of birth, and their name. What's your name? And sometimes if you have an elderly confused patient, you don't want to say like, hi, Mr. Jones, because they're just going to say yes. Mr. Jones will be Mr. Jones. He'll be Mr. Smith. He'll be whoever you say he is, he will be. He will be Superman. If you say, hi, Superman, hello, how are you doing today? So ask them their name. And if they're confused, check their ID band, check other verifiers. MARs should be available to students when preparing and administering medications. Worksheets should not be used. Students should prepare medications using only the original MAR and should bring the MAR to the patient's bedside for verification before administering drugs. By the way, MAR stands for Medication Administration Record. Teach students the organization's process to identify patients using 2 unique identifiers before drug administration. Partial drug administration. Students may not be administering all of the prescribed medications to assigned patients, particularly IV medications that they may not be permitted to administer. A patient did not receive an IV antibiotic for 3 days. Staff nurses were unaware that the students assigned to this patient were not allowed to give IV medications. All right, my dears. If you're a nurse, and if you're a student, like, again, it all comes down to communication. I always tell my student nurses that let the nurse know we can't do any narcotics. I don't do narcotics. I don't do the morphines or the Dilaudids. I don't even want to mess with that when I have student nurses. It's just, I don't want that liability. In most schools that we teach, students are not allowed to give IV medications. So let your nurses know that. Don't just say we're giving all medications. Say I will be giving all the PO medications at this and this time. A student nurse did not administer a respiratory medication to her patient. She thought a respiratory therapist would administer it. Again, ask questions if you're not sure. Ask your instructor. I really hope that you have an instructor that you feel like you can go up to and ask questions to. That's very, very important. Nursing instructors should provide a daily report to each unit that hosts students regarding the types of medications that the students will and will not be administering. Encourage students to confirm this information with the staff nurse assigned to their patient and to report drugs that are not given when due. Thank you so much for watching. I hope that now that you have learned about these medical errors, that you will learn from these. Make sure that you hit the like button, make sure that you subscribe, and make sure you turn on that notification bell. It helps me tremendously and it means the world to me. Thank you.